it's good to see you again. What we know clearly from the science now is that most people with COVID have no symptoms at all,
yes,
but they are infectious. And that's why testing and tracing those with symptoms and without is so key to controlling it. Now, since you last came before the committee, we've expanded testing capacity enormously, and we're testing more per head than countries like Germany and Spain. Yet this week, even people with COVID symptoms in Kent are being told they've got to go to Cornwall or Scotland for a test, or being told that there isn't one available at all. So do we have currently enough testing capacity available?
No, the short answer to that is no, we don't. And we don't have enough testing capacity now because in an ideal world I would like to test absolutely everybody that wants a test immediately.
So when will we have that capacity?
Let's be in no doubt that, however, that there has been a massive increase in testing capacity. It's gone up from 2,000 in March to 300.
Following the chairman's directions, let's consider when will the capacity be in place?
We'll be up at 500,000 by the end of October.
By the end of October. The Health Secretary told the Health Select Committee that it would be within 2 weeks. What's happened since then? Why has it been put back?
Sorry, what would be?
A week ago, Matt Hancock told the Health and Social Care Select Committee that the problem would be solved within 2 weeks from then. That's a week from now. What's happened from now till then to make it go back?
Well, I said, I said we'd be up at 500,000 a day by the end of October.
Okay. And 500,000 a day, will that be enough to meet the demands that you project at that time?
Well, we sincerely hope so, but what has happened is that demand has massively accelerated just in the last couple of weeks. And if you look at the graphs of people either asking for a test, getting on the website, ringing up for a test, they're going up.
And why do you think that is, Professor?
And I think the reasons for that are, I think that many people are seeking to get a test in the hope that they can thereby be released to get on with their lives in the normal way. And people who have come into contact with someone who has tested positive, for instance, they're seeking to get a test to ensure that they're okay to get away. And that is perfectly reasonable. And I understand why people are doing that. But the advice and the guidance is that people should seek a test not in those circumstances, but when they have symptoms. And what we're setting out today, or setting out very shortly, is the priority of the groups that we think should have tests, and the Health Secretary will be setting that out. As they do in Germany, we'll be starting with those who have symptoms, which are clearly the group that needs to have tests. And I think that in the case of schools, for instance, it's very important that people teachers, parents should look at the guidance about the Public Health England guidance from NHS Test and Trace about when you should get a test.
So if, taking the schools, is it the case that if whole classes are sent home to isolate for 2 weeks because someone has a cough in the class, if that's going to happen, are we not just going to be in a kind of rolling system of school shutdowns that's going to wreck education for the year?
That would be wrong, and that should not be happening, because the reasons for sending such a class home or a bubble home would be if, as I say, if somebody tests positive.
But the whole class has to go.
If somebody tests positive who's been in contact with the rest of their bubble, then they have to. Then the rest of the bubble has to self-isolate.
But they have to go while they're waiting for the test. They have to go while the person is waiting for the test.
No,
so
they have
symptoms.
They should go. They should go in the event of a positive test.
So they shouldn't vacate the school or the class until that person with symptoms has been tested positive.
That's correct. And if I may say, I think it would be of great advantage to the committee to consult the guidance that's been issued by Public Health England and NHS Test and Trace on that precise matter.
On the 500,000 figure, scientists on SAGE have said that 500,000 people a day will have symptoms consistent with COVID in a normal winter, a winter without COVID being present. So if the target is 500,000 by October, all that will do is to deal with the people who have symptoms, coughs and colds that they get anyway. So that won't be enough to deal with the additional risk of people with COVID symptoms, will it?
We believe that with the additional tests that we're laying on by ramping up NHS test and trace, we can make a very substantial difference. But you're making an entirely reasonable point. That's why it's vital, and you're making a point about the big increase in demand that we're seeing. That's why it's vital that those specifically with COVID symptoms should seek a test, and you should take steps that those who've been in contact with somebody who's tested positive should only do so, should self-isolate on the basis, as I say, of a positive test.
So final reflection, Chair. We knew at the start of the pandemic, everyone has agreed, the evidence my committee has taken, was that the virus spread because we didn't have enough testing capacity to test asymptomatic people. 6 months on, it feels like we've been here before. In April, the Secretary of State had to take a personal grip to increase the capacity. Will you and he do that to sort out the crisis that we have in the testing capacity?
I can assure you, Mr. Clark, that everything is being done that we possibly can to increase testing capacity. And I just remind the committee, including automation, batch testing, securing supplies abroad. Today we are commissioning 2 new labs, or a total of 4 new labs that we are building, as you will know, in across the country. We've hired another 300 people. Testing capacity just in the last 2 weeks has gone up 10%. And I've given him the figure of 500,000 per day that we aim to reach by the end of October. And just to remind you, Sir Burt, before people run down the UK's efforts, it really is worth bearing in mind that we are now testing more per head of population than France and Germany and Spain, and conducted more tests than any other European country.
But could I just emphasise, though, that if the schools start falling over for lack of tests, that will disrupt everything, the economy and everything. And Manningtree School in my constituency, 97% of pupils came back when it reopened. They've only got 88% of pupils there now. They've got a staff member off waiting for a test for one of their children, and they've got 13 pupils off waiting for tests.
Well,
how will we prioritise testing for schools to keep them operating?
Well, just to, perhaps, Sir Bernard, you weren't listening when I made the point to Mr. Clark that the people should not be sent home unless a member of the class or the bubble has tested positive.
Yes, but the pupils themselves are requiring to be tested. That's the problem, because of something that's happened in their home, not something that's happened at school. Well,
as I say, and I appreciate the frustrations of parents and of pupils who want more tests, and all I can say is that we are doing our level best to supply more tests, to speed the process up, to turn it round faster, and to ensure that people get tests as close as possible to where they want them. And I know how frustrating it is that people have been asked to go long distances, and we're doing what we can to bring those distances down. They have come down a bit.